Hi, everybody, and welcome to Your City, Your County. We're recording this on the day before Thanksgiving, so I hope you had a good Thanksgiving if you haven't had it, or if you've had it already, and if not, good luck with your cooking. Today, we're very pleased to have Cindy Kinnard with us. Cindy is the Kewaunee County Public Health Officer for Kewaunee County. And welcome to the show, Cindy.
Thank you.
It's good to have you here. It seems as though we've been talking about this topic for ever and a day. I remember when I first heard of COVID,
Yes.
and I remember thinking, oh, well, that's interesting. And I remember going through problems with COVID and going to meetings and said, well, we're going to close down for just a little while, and I'm sure we'll be back real soon. That didn't happen.
No.
We closed down for probably a couple of years. But you're very much involved with COVID. Can you give us, first of all, a little bit of history about it and maybe where we've kind of progressed to now and how it involves you and Kewaunee County?
Sure. So COVID has been with us almost 4 years. In March, it will be 4 years that it hit Wisconsin. And how I am involved is the health department has been taxed with following communicable diseases. And so those communicable diseases get reported to the health department, and then we have to reach out to individuals who are sick and make sure that they understand guidelines that will help prevent the spread of that disease.
How has your role changed from the very beginning to where we are now?
Sure. So at the very beginning, we were getting orders through the state health office and straight from the governor's office on a daily basis. And things were changing very, very quickly, as you remember. We went from not quite sure what it was to locking down, and then to opening back up all of our businesses and our schools, and then to progressing to learn how to live within COVID and how it's going to change what we do on a daily basis moving forward.
And I imagine at the beginning it was extremely difficult for you because there were no vaccines, there were no shots, there was nothing that you could take for it. And we were seeing people passing away and getting terribly sick.
Correct.
For a long time.
Yeah, we saw changes on a daily basis. So the state health office would have a conference call with us every day at 1:30 in the afternoon, and we dreaded that hour because the guidance changed on a daily basis.
Yeah.
And so until those vaccines came out, we really were kind of at the mercy of the disease. Now it's a little bit better controlled, and we've seen even more changes now. We're still seeing sick people, but that has been better controlled. We still see a few deaths, and we're going to do that because this disease it's not going anywhere. It's going to stay with us. So we've just learned to, I think, manage it better.
It seems as though now we hear more about COVID as being, oh, I got a really bad cold and it was COVID. Is that more typical of where we are now?
I think so. I think that, it is one of our top listed respiratory diseases, but now it's in the same categories as influenza and RSV, those kind of things. So we're going to progress with the knowledge of we need to control it as a respiratory disease. As of November 1st, the state has changed it. It was a Category 1 disease, and what that meant was that it was considered a little bit unknown, highly contagious, and it was reported to the health department in a very quick manner, and we were given 24 hours to try to reach out to people that were sick. Since November 1st of this year, they've changed it to a Category 2. So it falls in that same category now as influenza. We are not hearing about all of the illnesses anymore that are out there. They're not testing for it nearly as much, but they do test in hospitalizations. And so we find out about people who are hospitalized with it. So that's where the change is. Many people can probably relate to the health department calling them when they tested positive, and then we would go through the guidelines as to how to stay home, isolate at home, what to do with their contacts. We're not doing any of that anymore. So we're not contact tracing, and we are just alerting people when we know that they've been hospitalized with the disease, how to progress from that point on.
Okay. I, at the very beginning, had COVID before there were any vaccines for it. I was very fortunate, and I got, a bad, it was like kind of, it was kind of like a bad cold. I had a backache and just didn't feel right for about 3 days. And then when the COVID shots came, I got all of those. And then it was, gosh, I guess maybe 3 months ago or something, I came down with it again, even though I'd had all these shots. Is it still important for me to continue to get shots? I haven't lately.
Yeah. So what we're seeing with COVID is that new variants are emerging. And as those new variants emerge, people can continue to get sick. It's the same as influenza. Every year we offer the flu shot because the variants change within our community. And we watch it over a year to see which variants are most popular. And that's what we're kind of going to now, is that they're going to offer this COVID shot once a year with the variants in it that are what they're seeing in that community at that time. And then hopefully that will prevent people from getting that illness again. So it's going to be similar to what we see with influenza.
I must have gotten the more popular kind.
Well, there's been a lot of variants out there. So we are offering that vaccine right now through the health department. There have been changes with the vaccine as well. It is no longer a free shot. When the country declared that COVID was no longer a state of emergency, that free vaccine went away. So now we can bill it similar to how we do your flu shot when you go into your doctor's office or the health department for that. And that vaccine is available here at the health department, in Kewaunee County, but also we do have a few of our pharmacies, local pharmacies, the hometown pharmacies are carrying it as well. None of our local clinics, I believe, have it at this point, but some of the hubs in Green Bay are distributing it as well.
So there are a number of places you can get it.
Correct.
And they can call you and you can advise them where to get it?
Absolutely.
Or they could call their local pharmacy or...
Correct. Yep.
their doctor.
And if people don't have it in, I know we run a waiting list and we wait until we know that we have enough doses, that people need enough doses, and then we'll order a supply of it. So right now, we're at that transition right now. We're waiting for our next shipment to come in, which should be with us next week.
Okay. Do you still see long-term results of COVID? I know that there was, I can't recall what they called it, but it was a long
Yep, the
term.
long COVID is
Long
what it was
COVID,
called.
yes.
And I think people, we're hearing less and less about that. And it's kind of the variants that are out there now are a little less severe than what they had been when they first emerged. So there are still people that are suffering from some of those long COVID symptoms, but for the most part, we're not hearing nearly as much about that in the community.
That's good. So maybe it's not as severe anymore.
That's what I'm kind of hoping. Yeah.
Good. Yeah.
Yeah.
There are still some people that you see at various locations wearing masks. Is that still a good idea?
It is, and it could be for a number of reasons. If you have an immune system that maybe is a little bit weaker than some, this time of year, especially with all of the different respiratory viruses that are out in the community, it's a good idea to protect yourself. We still, when people do call into our office, if they've taken a home test and they say, well, I just tested positive for COVID, what should I do? Our recommendations really have not changed now in well over a year. So we are recommending that they isolate at home for 5 days until they're feeling better. And then we recommend that they wear a mask in the community for 5 days, simply to stop that spread from going further. So some of those people might just be recovering from COVID too that are wearing those masks.
Okay. What do you see in the future? Is it possible to predict where we're going with this, or are you kind of as unknowing as I am?
I don't have that crystal ball, but if I had to take a guess at it, I think it's going to be treated very similar to influenza. We're going to see a new shot come out every fall that's going to be recommended for people. And moving forward, I think that those test kits will be available for people, maybe in local pharmacies or stores like that, and they can test on their own and then follow the basic recommendations. But I think that 5-day isolation period, that's not going anywhere because it is a contagious disease. They're going to continue to recommend that. And it's really no different than what they do for someone who has pertussis, which we don't hear about a whole lot. You know, they're treating it in a very similar manner to that.
Yeah. Yeah, okay. Well, I got my flu shot anyway.
There you go.
So now
good.
Maybe after talking with you, I think I'm going to have to go get my COVID shot probably again. We're talking with Cindy Kinnard. She's the Kewaunee County Public Health Officer. And how long have you been on the job, Cindy?
I have been with the county for 26 years.
Oh, my gosh.
I worked 17 of those as their public health nurse out in the community, and for the last 9 or so years, I have been the health officer.
Wow. What kind of changes have you seen in the county over the years with health care and not to put you on the spot or anything.
I think we've seen a lot of changes. You know, we used to be a lot more hands-on in the community. We're seeing a little bit of a transition to partnering more with some of our community partners to get some of the work done. So for instance, a lot of the flu shots now are given at clinics versus at the health department. Vaccines the same way, they're given at well child checks, and here in Kewaunee County they used to be just given by the health department. So we have seen some changes in our basic practices. Telehealth has become a big thing, so people are able to do a lot of telehealth just from their home and not running into...
Tell us a little bit about that, if you would.
I'm not an expert by any means, but you know, a lot of health insurance companies will offer that as a free option, so you're not paying the copay when you go in, and they can talk about basic services with you. So for instance, if you have a sore throat, strep throat, ear infection, urinary tract infection, things like that, they can walk through your symptoms with you, and based on what they hear, they're able to prescribe over the phone, and it saves you a trip in.
So they're saving a little money.
Correct.
Probably too.
Right.
I knew there had to be a reason they were doing that. I always just thought it was out of the kindness of their heart, but,
No.
but apparently not.
Correct.
No, so, okay. Another project that you tell me you're involved with, and I don't know much about this, but is the Giving Tree for Sarah.
Correct. So this time of year, we do a Giving Tree, which is a way for the county to organize a food drive and hygiene product drive. It's in honor of one of our coworkers, Sarah Millay, who was killed in a car accident on work hours about, say, I think it's about 12 years. And so 12 years ago. So we do this every year for Sarah's honor, because she was very giving back into the community. So we do this food drive. People can drop off non-perishable items at the Health and Human Service Center right in Kewaunee. In addition, they can mail in donations and just title it to the health department for the Giving Tree. And then whatever we collect between November 27th this year and December 31st will be divided up between the 3 food pantries within the county to share those donations.
Where are the 3 food pantries located?
Sure, there is one in Kewaunee at Holy Rosary Church. There is one in Casco at did I think I said that wrong? At Holy Rosary Church in Kewaunee, at Holy Trinity Church in Casco, and then there's one right here in Algoma, the Kewaunee County Food Pantry.
Oh, okay. Very good. And what kind of foods are you, I know it's non-perishable. You don't want to bring in an apple or an orange or something. I usually store those at home, and they're about that big now, you know, and they're all dried up. But what kind of foods or items are you looking for?
Sure. So food-wise, they're trying to do a push towards some of the healthier items. So it might be some of the soups. canned soups, but they also look for things like canned beans. They look for items like maybe pancake mix or syrups.
Oh, I'd love that. Boy, can I get on the list?
To make a good, healthy meal with that. So they take a lot of those kind of products. And then also they do hygiene. So the shampoo, conditioners, toothpaste, deodorants, soaps, those kind of things as well. And then finally, one thing that the food pantries don't get a lot of, but they can give away, are like diapers and baby wipes, things like that. So we're taking all of those items right now, and like I said, dropping them off at the health department. We have a Christmas tree right in the waiting room, and that's where we collect them.
That's great. And they can also drop them off, I'm sure, at the various locations, the
Correct.
3 locations
Yes.
that we talked about.
Yes.
Too. Where is your office exactly?
We are located.
I don't know where to go.
Sure. We're located at 810 Lincoln Street in Kewaunee. It is the back half of the administrative center. For those that might be a little bit older, they might remember it as the Kewaunee Hospital.
Oh, yes, yes,
so
of
that's
course, yes.
that's where we are. Yeah.
Okay, very good. And what are your hours there?
8 to 4:30, Monday through Friday.
Oh, that's pretty good.
Yeah, and like I said, it starts on Monday. We are closed Thursday, Friday this week for the holiday, but Monday morning we'll open up for that.
Sure, and we're talking the day before Thanksgiving, so that would be the 23rd and 24th of November
Correct.
that we'd be talking about. What are your plans for Thanksgiving?
Oh,
Anything
getting together
special?
with family.
That'll
So
be
I'll be
nice.
cooking in the morning, and then for my husband's family, and then my family in the evening, and I get
wow.
cooked for. So that's kind
Oh,
of nice.
wow, that's
Yeah.
great. I remember many Thanksgivings we'd make Thanksgiving, or my mother-in-law would make Thanksgiving, and we'd have a big meal at noon, and then, we'd stick around and she'd have all the leftovers. Yeah.
Exactly. And you take the nap in between, right?
You
Because you got to
do,
recover from all
yeah.
that food.
Yes. And I do recall one year that she served a large Thanksgiving at noon, and then we went to my folks' house and had a nice large Thanksgiving meal, and it was about all I could do, to survive that. But it was delicious. But
Exactly.
I found it hard. I've heard lately that, in fact, I was listening to the radio this morning, and they were talking about obesity being a problem, and the problem that people are eating prepared foods, foods that may be loaded with sweet stuff and that sort of thing. And I've heard reports that can cause not only stomach problems, but it can cause cancer and also Alzheimer's. Have you heard any more information on that sort of thing?
The foods that we eat affect us tremendously in a lot of ways, and anytime that we are overweight, it affects the quality of our life, either through disease or through heart disease, those kind of things. So the health department actually has a 5-year plan that we go over, and we have several goals with it, one of which is nutrition and physical activity and reducing the rates of obesity within the county. So it's interesting you asked me this because it is one of our goals to work on. And we do a lot of wellness throughout the community to try to enhance the quality of life and decrease that amount of obesity in our populations. But what we have seen is that when people are overweight or less active, it increases their risk for diabetes, it increases their risk for heart disease, it can lead to cancers, it can lead to dementias, it can lead to all sorts of chronic health conditions. So really and truthfully, by trying to increase the more exercise you do and the wellness habits that you live by, it can really increase your quality of life.
I had an interesting experience last week. I set this goal of walking a great deal, and I gained weight. This week I haven't walked at all, and I've lost some pounds.
Go
So I
figure,
don't
right?
know why. I don't understand it.
Go figure.
Yeah.
Water weight, maybe. Who
Maybe
knows?
that's
I don't
it.
know.
Yes,
Yeah.
yes. I try and stay away from salt, and
Yep.
that seems to help. Salt's a big thing too, isn't
Yeah,
it? Really.
yeah. I mean, a lot of the processed foods that we eat now, because of convenience, are very high in sodium.
Mm-hmm.
And those kind of foods can actually lead to a number of those chronic health conditions as well as obesity. So my office is very blessed to have both a nutritionist and a registered dietitian.
Ooh.
So we do a lot of teaching within the health department on healthy nutrition, healthy dieting, and wellness overall. So we have some exercise programs going on, different things like that throughout the year that really focus in on those areas.
That's great. I'm lucky enough. There's a class that I attend once a week, and they go over what to eat, what's good to eat, what kind of exercise to get, and it seems as though they talk a lot about protein.
Yeah.
That's a biggie.
Right, exactly, because protein fills you up, but it lasts longer in your system. So you're not running back and getting those quick little snacks. And sometimes those quick snacks are the foods that you need to avoid,
Yes.
right?
But those donuts are so good. At work we have a food court. And boy, there's the most delicious stuff there, and you go buy it every day, and you kind of go, oh.
Well, the big push now is for the whole foods. So
Yeah.
trying to eat the fruits and the vegetables and nuts and those healthy fats that increase cardiac health.
So I've threatened to bring in apples and oranges.
There you go.
and bananas.
Absolutely. Yeah.
So we'll see how that works. We'll see how popular that may be.
Correct.
I don't know. You work with grants at your office as well. I know that I've worked with a couple of organizations where grants are really important. They help finance all kinds of good things.
Right.
What kind of grants are you working with?
So the health department has several grants. Over half right now of our overall budget is grant funding through either the state or the federal government. Some of the grants that we work with would be the Women, Infants, and Children. So that's the WIC program, which helps supply nutrient-dense foods to pregnant women and also kids under the age of 5. But in addition to that, we do our immunization grant. So I think that's probably the one that we're best known for, because you see us out in the community giving all different kinds of shots, primarily vaccine for children. So we are the people that vaccinate kids in the community. Another child program that we have is Fit Families, and that grant encourages families to mentor their kids in a certain way. So less screen time, eating fruits and vegetables, healthy drinks, so less sugary drinks and more water, all different kinds of things that really, when mentored at a young age, turn into lifelong habits for kids. So we do that. We have a lead poisoning prevention grant. We also have an overall preventative health grant, and that's the one that we focus on wellness and some of those walks or exercise classes, things like that we do in the community. And then right now we have a lot of COVID grant funding. So, and that's just, it has changed throughout the last 4 years. So at one point it was focused on testing and contact tracing, and now it has moved more towards vaccination and also to recovery. So how do we get our workforce back up and running, because health departments took a pretty hard hit during COVID with staff that had high burnout rates. But also just how do we help the community to recover from COVID as well? Get policies and procedures in place that moving forward will help us in case a new disease emerges and we don't have to shut down everything all over again.
Yeah, maybe you can learn some things from when COVID was going
right.
so
Important
strong.
lessons.
Yes. Obesity is a problem. I know it's a problem with kids, too. As you were saying, as you mentioned, kids are watching a lot of TV, probably more computers, and the games that they play, the electronic games and that sort of thing. How do you manage to encourage someone to not do all of
Right.
that and
So
to get out there.
we offer some incentives through some of our grants that really push kids to maybe reverting back to the 60s, 70s, 80s, where they got outside and played. Can they play hopscotch? Can they jump rope? Can they hula hoop? Can they do, maybe it's kicking a ball around or throwing a football or playing basketball, but it's some of those physical activities that gets them off the couch and back outside, getting some fresh air and getting that movement. And then for their parents, we have encouragement as well. And in addition, the health department has really focused on partnering with our Park and Rec program in the county. So Parks and Promotion out of the county offices has partnered with us on offering trail walks, and we encourage the use of our county trails to get people out and moving and experience something that they may not even realize is in the community.
Yeah, and we have such a beautiful area for hiking, along the lake or through the woods or in a county or the indoor county with all the state parks.
Yeah,
and
exactly.
all of that.
We've done a couple of trail walks at Bremer Park recently. We've done a storybook walk there with the kids. So, I mean, there's a lot with the zoo going on and stuff like that that can bring families out, and it's really an enjoyable experience for them.
I remember as a kid, and so this kind of shows how far back I think this problem was gone, when TV came out. And believe it or not, I do remember the little TVs. Al Reinhardt used to sell
Dating
TVs
yourself
too.
there.
Yes,
No.
just a little. They were about that big, the screen, and I remember wanting to watch Howdy Doody. You may have heard of Howdy.
I have.
But anyway, my mom would say, "You're not going to watch Howdy Doody. Get outside and play."
Right.
And so I really think it's been a problem ever since, certainly I was a kid.
Yeah, and the more technology emerges,
Yes.
the less kids tend to do outside, and the more they're doing on that technology. So we really need to just take a step back to the basics and get back outside and get that fresh air and have them play.
Absolutely. Anything else that you do that we haven't covered today?
Well, I can make a plug for one more program that
Good.
we're partnering with the Sheriff's Department on, and that's the Toys for Tots drive that's going on right now for the county. So our Sheriff, Matt Joski, is in charge of that, and you can call the health department to register for it. So people who are in need of assistance during Christmas can get some of the toys or gifts that they need for their kids. I believe it's for 17 and under. But that registration is through the health department right now, too.
Okay, very good. I know Matt's very involved in that.
Always,
And
yes.
he's a good spokesman for that. And
Yeah.
he's done so much. And being a Marine, I believe,
Yes.
is in his background.
Exactly.
And so on. So if you want to do that, call Matt, right?
Right, exactly.
Right?
Exactly.
Just call the sheriff. I want to do some toys. Okay. Well, unless you can think of anything more that we haven't talked about, I think we've covered the waterfront pretty well.
I think we have covered it well, yes. Thank you for having me out here.
This has been fun. I thank you so much for coming. And you have a great day, and have a great Thanksgiving.
You too.
Thank you. We've been talking to Cindy Kinnard, and Cindy is the Kewaunee County Public Health Officer, and for Kewaunee County, obviously. And we thank you for joining us. We hope that you have a very happy holiday season, whether it be Thanksgiving or Christmas or Hanukkah, whatever. So enjoy yourself, have a good time, and we'll see you next time when it's time once again for Your City, Your County. I'm Bob Gray. Bye, everybody.